and the gut are interconnected, right? Probably why there's a lot of serotonin in the brain, but also in the gut.
And I'm sure you know just as well as if there is a strong psych component or depression component, it can manifest as a gut component. So if we're not treating one, then you feel like, okay, I may be healing one, but then I have problems in the other. It's a very strong balance between the two.
Hi everyone, Dr. D over here. Today in Dynamic Talks, I have board-certified gastroenterologist Dr. Zaid Rana. Welcome in. Does psych clearance actually improve outcomes, mentally, behavioral, or even metabolically?
If you're a psychiatrist, especially if you've been with that same psychiatrist for some time, and I say psychiatrist or psychologist because they both have their uses. If you've developed stability with that person and you can trust what you're receiving for them, they're saying this patient's at a good portion to go through the procedure, then that tells me thereafter, then more than likely, obviously medicine's not 100%, right, but they will do better. Why? Because they've had the support that we keep talking about. They've had somebody to rely and fall back on that. Let's say things are starting to get a little tough. And I say tough because once you do the procedure, whichever one's out there, whether it's the bypass, the sleeve, or the endoscopic sleeve, you need support. And we're now taking away certain foods that you're used to eating, and now your body's going to say, or the cravings are going to kick in, let's say, and you're not maybe sure how to manage that. That's where having your psychiatrist will really help for them to understand, because they've been with you for so long, how to manage that aspect. And with our team as well to make things a little bit more interesting on the nutritional side.
Please educate us on how the post-op care after you had a sleeve or after you had, a gastric bypass is, because I've heard that it's very, very strict. There's a lot of patterns and a lot of instructions that you have to follow. So I take that. That's why it's so important that the patient is really emotionally stable and aware of what the post-op care entails.
Absolutely. I mean, that's the most important part of it, at least with us at Bariendo. The moment that consult happens, somebody has already started screening to see, is there anything that may hinder you from going through the procedure? And that means psychosocial as well. Once that procedure is done, you will then meet with me as well as our nutritional team, and you'll have somebody following you for the first 4 weeks. And then thereafter, you have a nutritionist and an ARNP following you for the next year. So somebody's going to be constantly keeping you and holding you accountable for what does your dietary habits look like. One of the things that we also do is we send an electronic scale. And we tell every patient that this scale will also upload to us in the cloud. So that if we're seeing habits changing, we can see early on, hey, what's going on? What do we need to do? Or did something happen? Maybe you went on vacation. Okay, well then that makes sense. Maybe something else drastic happened in your life. So we can start addressing that early on so that we're not lagging behind and then planning to play catch up.
Tell me, what is one thing that you would wish that every patient who comes to get a gastric bypass would know before they come to you?
That it is not an easy process. We are rewiring the brain pretty much. And that's why we say it's such a strong gut-brain interaction, because you imagine your body's so used to getting that comfort food when you're not feeling well. And all of a sudden I'm taking that away for a period of time. I know it's going to cause other manifestations. Yes, we're going to get the weight loss. We're going to get there. But we can't get there if we don't have a healthy brain too. So that's why I tell everybody, don't come in here thinking, oh, we're going to do a procedure and that's it. We're going to move on and I'm going to lose all the weight. No, there's a lot of other aspects that go into this.
Right. It's funny that you mentioned that, because I tell my patients, don't come here thinking that I have a magic pill, because I don't. It's like, don't think there's a magic procedure, because there's none.
There's not.
Everything has benefits and risks, and everything has post-op care. Even if you take a medication, you gotta follow up with it. You gotta make sure that you follow the instructions, that you're compliant, that, So same thing with a procedure. Tell us a little bit about after surgery, like, can patients go back to exercise? How's the eating? Like, is there a specific diet that they had to follow?
Awesome question. So with the endoscopic sleeve, which is pretty much you're going with an endoscope, a camera, and we're shrinking the stomach with sutures. We reduce it by 60 to 75%. What happens thereafter is, about the next 6 weeks, you're going to be on a high protein liquid diet. And a lot of people think, well, it's a liquid. It's protein content. So you may be hitting, depending on your BMI and your size, maybe 40, 60, 80 grams of protein in the form of liquid. Why? The goal is to try to maintain the muscular aspect of it while losing the fat aspect of it. So it's done for 6 weeks, because we know from our data that those sutures that we put in need about 6 weeks for it to pretty much adhere and stick together. And it's no different than if you had a bypass or a sleeve, because the amount of time of that liquid diet may vary, maybe 4 weeks, maybe 6 weeks, maybe 8 weeks. But ours, we find, is about 6 weeks is really good enough time, is as those sutures will stick together. Thereafter, while you're meeting with the nutritionist, you'll pretty much be segued into the next phase of the diet. And the phases all come with all surgeries, because you don't put everybody immediately on a very solid diet.
Of course.
That's very true for all surgeries. just that time frame is going to change. But somebody will constantly be helping you to figure out, is it a good time for you now to segue into the next phase? Now with this, the beautiful thing is that we don't make any rules. We're going with the scope, we put sutures in, you go home the same day. Usually by day 4, you're back to work. So if you did it on a Friday, hopefully by Tuesday, you're going back to work.
Okay.
Exercise-wise, I recommend everybody that first week, it's better not to be doing anything because you're recuperating. You're going to feel some sort of like bloating and gas and some discomfort. It comes with all surgeries, all procedures. This one, the most common is like you feel a little bit of pain underneath the breast line. But usually it's the first 72 hours, and after that, it subsides. Week 2, I recommend everybody to be using resistance bands. Why? Because I don't want people squatting or deadlifting. Not because of the sutures I really worry about, but more so I don't want them to find a reason to say, oh, I pulled a muscle out. Is it the suture that broke? Is it something else happening? And again, you're just kind of starting in that higher protein liquid diet, so you're in a calorie deficit a lot of times. Yeah. By week 3, week 4, you're probably already lifting weights again. If you're somebody who works out, we tell you to go half of what you normally do. If you're someone who's never done it, I tell them, don't try to become Mr. or Miss Olympia overnight. We're going to segue into that slow. Yeah. But we have a whole team to help them at least start that aspect. Because a lot of times people have not worked out.
Yeah, exactly.
So, they're being taught how to do it. But walking throughout the whole time. Okay. Walking is the best thing you could be doing after the procedure.
I take like moderate walking, maybe not at 1 p.m. with the Miami sun because it's so hot right now, right? So probably early walking or late afternoon, right?
I tell you, a lot of people live in your golf courses and your parks. Just go for a little stroll in the morning or in the evening.
Yeah.
Go with your family. It makes for good conversation. It helps your brain relax. It helps the gut relax. And sometimes you can even sleep better.
So what is the biggest myth patients have about their gut health in relation to weight or mood?
If I lose weight, my brain and my gut will get better. That's not the case, because it's not just about weight loss. It's about the kind of food you're eating too. It's about how strong or how mentally fortitude you actually have as well. Because like we've been talking about this whole time, that dysregulation between both, just because you fix one doesn't mean it's going to fix the other. They both have to be fixed. Otherwise, we're not going to get anywhere.
It's a balance. It's a balance. It's like, yes, like I always say, looking pretty, it's very important, especially in Miami, but also feeling good from the inside out is equally as important.
Absolutely. I mean, social media plays such a huge role, especially here in Miami, that it causes us to often have a dysregulation. So if we're not able to fix the gut side and the brain side.
Yeah. And I'm mentioning this because I've had patients who told me that they went and got surgery, whether it was a gastro bypass or plastic surgery, because they thought that was going to make them feel better. And yeah, they felt better for the next 6 months. And then they ended up coming back to me and they're like, I'm still in the same hole that I was before, because I thought that just by looking nicer at myself from the outside was going to fix how I was feeling on the inside, but that was not the case.
And I think that's where, a lot of times that GLP-1, the Ozempic, and the Mounjaro really kind of thrive, because a lot of people thought, oh, great, I can take this, I'll lose weight, I don't even have to do surgery. But then we found, how long were you going to inject for? A lot of times it's supposed to be a helper to get changing of your habits.
Correct.
But if you don't change the habits, you're losing weight, but the moment you stop,
you're gaining that. Yeah, exactly. You're gaining that weight.
So imagine that vicious cycle you put your own body in where, okay, I lost some weight, I'm starting to feel better. And then I put it back on, so I start to feel worse again. And then your hormones just going back and forth.
If you could teach patients one thing about how GI health impacts mood and weight, what would it be?
You can find that healthy balance. I understand that we all live in a constant stress. I don't know if life could ever be without stress. You have work stress, you have family stress, you have home stress. But if you can learn to manage the stressful aspect of it, and that whether that's doing something just for yourself, whether that's yoga for a little bit, working out for a little bit, no one can tell you not to have comfort food. That's probably impossible. Yeah, everyone enjoys.
We're human.
Exactly.
We crave certain things. We crave chocolate or a glass of wine or fat food or greasy food once in a blue pill.
But it's about some moderation.
Moderation.
If you can learn how can I moderate and keep this in balance, I find that people just as a whole will do much better.
Yeah. So tell me, are there any new research or any new treatments, emerging treatments now in terms of like helping with weight gain or helping with losing weight, anything
in the pipeline? So good question. Now in the era of AI, I'm finding that a lot of times people are using AI coaches, because it is hard to maybe go see your psychiatrist every day or going to see your health coach every single day or your nutritionist. But having somebody in the AI world that can at least hold you to some degree accountable. I'm not saying they're giving you medical advice, no. But sometimes people just need to talk. Sometimes people just need to get something off their chest, and that may avoid them from having to go eat something that may be bad for them, because they're not using something to replace it. So I'm seeing more and more of those things at least kind of fill in as an interim till the time maybe they can get to their next appointment. Now, is it really efficacious? I'm finding that, I'm hoping, I should say, that it is. I think we're probably going to take some data, some more long-term data to really find, is this useful or is it more harmful? But I think we're seeing that it is giving people an option to do something daily, because it's very hard to see your healthcare practitioner every single day. And I'd say, the other side of this, for weight loss side, at least at Bariendo, we're always finding, is there other ways to do this? And in the pipeline, the endoscopic sleeve is something relatively new that was FDA approved. Well, it's been around for some time. It was more recently FDA approved here in the US. You have new GLP-1 drugs coming out that are supposed to have even higher efficacy with weight loss. I find the obesity world so fascinating. Why? Because we're finding and innovating every single day a new way to help patients lose weight.
Tell everybody, like, where can they find you? What do you do? And, how to reach out to you.
Bariendo.com is a great way to kind of reach us on the internet. I have my social media as well. We post videos on how the procedure works and some nutritional advice and things like that as well. My office is in Doral. So if you guys ever need, we're right by City Place, Doral.
Question: do you see patients doing tele?
I do tele, yes, I do. I do like, at least for my initial visits, to be in person. There is an aspect, that human touch that comes with being able to see somebody and how they react to certain questions. It's very easy to maybe not show that when you're on a tele visit, but especially as things like IBS and things like when you want a site clearance for obesity, you want to be able to see, okay, are you just rehearsing a script to me? Or, because your body language says a lot. So I think those first visits are really important to have in person. And then afterwards, once things are moving, televisits are perfect.
So thank you, everybody, for watching. I hope this stuff was very, educational and educative for you. We talk about obesity and obviously the relation that it has with, emotional health. So until next time.